Hi, everyone. Jen Broyles here, and I am so excited to have with us today Dr. Christine Maren. She is a functional medicine practitioner and founder of a high-tech innovative medical practice. She was born and raised in Colorado by parents who promoted an active lifestyle and good nutrition, and this upbringing really inspired her interest in holistic medicine at a really early age, but it was actually her own personal health challenges with chronic digestive issues and autoimmunity, hypothyroidism, gluten intolerance, and recurrent pregnancy loss that motivated her to study functional medicine. And using functional medicine and that model, she works with patients to identify the root cause of their chronic disease. And her approach to patient care is really individualized and personalized, with an emphasis on the way that our environment, our food, and our lifestyle choices interact with our genes. Dr. Maren is board certified by the American Board of Family Medicine and is an Institute for Functional Medicine certified practitioner. She's incredibly compassionate as a clinician. She's a speaker and wellness advocate. She's married to a surgeon, and together they balance their rewarding careers with raising two children, almost three, and I guess in just a few months, right?
Yeah.
And you can learn more about her at drchristinemaren.com. So welcome.
Thank you. I'm so happy to be here.
So glad to have you here. So tell us a little bit about yourself. I know we just went through your bio and we learned a lot, but what really drove you to become a doctor and then get certified in functional medicine?
Well, naturally, I just was interested in health and wellness. I mean, actually, when I was in college, I was a finance major initially.
Oh,
and little facts, little people know. And I realized one day, I really remember this day. I was like, 18, 19 years old, and my friends were like opening the newspaper and reading about stocks and bonds, and I was like, I could care less. I was teaching group fitness classes, and I was like really into nutrition, and I just realized that's not quite right. And then after that, I studied abroad in Mexico, and I did some mission trips in the Dominican Republic, and I had a lot of experience just working with the underserved. And so I felt this very strong calling to become a physician because I wanted to help people. I know it sounds sort of like the thing you hear every doctor say, right? But that's what really drove me to practice medicine. But like my bio said, I was also raised in Colorado. My mom, fed me homemade yogurt. I just came from this very sort of holistic background. And, my sisters had autoimmune thyroid issues and went about it a different way than the conventional path somewhat. We had experiences, of course, with conventional medicine, sometimes not all that great. And so when I ended up having some issues in college, I sought out an alternative medical provider and ended up having a lot of success with acupuncture. And so just sort of my background led me to want to become a holistic practitioner. And, I thought about naturopathy. I thought about becoming a chiropractor. I really kind of crossed the board and ultimately decided to go to osteopathic medical school because I felt like that was sort of a good marriage and would give me a good foundation and allow me to practice how I wanted to practice. Functional medicine specifically, I got into after my own health issues came to light, sort of, my professional and personal paths sort of collided. And I sought out a functional medicine practitioner for myself because I knew that I knew my issues were not going to be solved with conventional medicine, yet I still saw 6 conventional medicine doctors just kind of to go through the exercise of it almost. Mm-hmm. But ultimately I knew, functional medicine was what was going to help me mm-hmm. and what helps me heal, and sort of in that space, I started my training and, was a patient and learning practitioner all at the same time. So.
That's awesome. I feel like that's the case for so many practitioners in kind of that functional integrative world is that, they got sick in one form or another, conventional medicine didn't work for them, and they discovered, healing this way and just kind of developed a passion for it. So very, very cool. And so our topic today specifically that we're going to be discussing is SIFO, or small intestinal fungal overgrowth. And so was that the underlying issue for you, or was that one of the things?
Yeah, for sure.
Yeah. Okay.
Yeah, very much. That was
Okay.
the I mean, there was a lot of things, and I always tell patients, it's a lot of little things that sort of tips the bucket, right? It's not usually one thing alone, because I think our bodies can usually handle that one thing. I mean, actually, when I was little, when I was very young, I was super healthy. I mean, I came from, I have a really good, like, underlying strong constitution, and it took like years of abuse, and sort of like I look back in retrospect and I see like 15 years of warning signs that were just like not a big deal. I mean, I could live with it and I didn't do much about it. I didn't realize like gluten was an issue until much later in life. So anyways, yes, SIFO was like a huge part of my story. Yeah.
Yep. And I think it is with a lot of people, and I know this is one of your specialties now. I mean, obviously you've experienced and overcome it yourself, and now you're helping others do the same. And with you being trained in conventional medicine, why don't conventional doctors know much about this? I mean, it is such a widespread issue.
Yeah. Good question. I mean, I think there's a lot behind that. I mean, truly, there's really not a lot of research behind it. There's just emerging literature on SIFO itself. So I think by now, most conventional doctors know about SIBO, which is small intestinal fungal overgrowth, and there's a lot of literature behind that. And when there's literature, usually, doctors eventually pick that up. But for fungal overgrowth specifically, it's really one of those things that's overlooked by conventional doctors. Now, infectious disease doctors, on the other hand, they know something about fungal infections, but they're working with people who have immune deficiency. So generally that means people who have HIV or AIDS or some sort of severe immunocompromise. That's when they're looking for fungal infections. Some other rare cases like, a pulmonologist might be working with somebody who has like something called allergic bronchopulmonary aspergillosis. I mean, it is like the last thing they think of after everything else doesn't work, and like somebody has some crazy like high IgE and a chronic cough and etc. But in general, I'm trained as a primary care doctor. I mean, I don't think fungal infections were like on anybody's radar really. And it's like, because you're not immunocompromised. If you don't have AIDS, you don't have a fungal infection. But the truth is, like, many of us are immunocompromised to differing levels, and that can be pregnancy. It can be, that you have some food intolerance and you're still eating the things that are aggravating you. You don't either know about it or you don't care enough to like change your diet because it's not that much of an issue. It could be you have underlying celiac disease that's been undiagnosed. It might be you live in a moldy house. I mean, there's all these different variables that can actually make you immunosuppressed. But then beyond that, I think just from a conventional perspective, sort of the paradigm isn't so much looking at disease on a spectrum. So I'll give you an example. Like when I see somebody who has blood sugar disorders, I look at something called a hemoglobin A1C, which looks at the average glycosylation of hemoglobin, which means like damage by blood sugar. So if I see that number creeping up, into the high fives, my radar goes off, or, even like the low fives, because I'm looking at it from a spectrum. It's not like you just become diabetic all of a sudden. It's like things happen slowly over time. And so, unless you're like have fulminant like disease, like allergic bronchopulmonary aspergillosis, like they're not going to look at the in-between where somebody's like got this chronic underlying cough, but they're not like totally, sick. So
right.
I think, that paradigm is another factor. Why else? I feel like there's some other reasons that I'm not thinking of right now, but it's just generally kind of one of those things that's overlooked.
Yeah, no, I agree. And I think the whole disease spectrum is a huge thing. I mean, I used to work in pharma sales and I sold diabetes medications, and it was all about that, that number, if you're under it, oh, it's fine, but
until like it's six, like magically it's 6.
I know, exactly. It's like you hit 6. Okay, now we need to talk, it's like, what? Yeah, it's just, it is kind of messed up. So, I know you work a lot with people who've been diagnosed with IBS, that lovely term that means nothing. So how do you know if what?
I love that you say that.
Yeah, it's like
you might like, what is IBS?
I know. What is that? What does that mean? Yeah, I know. It is just one of those funny terms. But how do you know if Candida or SIFO is really the missing piece of the puzzle? because IBS, since it's so generic, and it's just a classification of symptoms, it can be so many different things.
Yeah, right. Totally. Yeah. I mean, I tell people like IBS is not your problem. IBS is a diagnosis so that you can get things paid for and covered. But often the problem with IBS is that you get diagnosed with IBS and then people think, well, that's their problem. They have IBS. But the real problem is like, well, what is irritating your bowel? Like, what is the underlying issue irritating your gut? So, so SIBO and SIFO really have a lot of overlapping symptoms. So like gas, bloating, diarrhea, indigestion. I mean, SIBO can definitely be constipation predominant, whereas I see that SIFO is generally diarrhea predominant. SIBO can kind of go either way. So it really is, it's difficult. I think you have to do a lot of testing. And I think really it has to be functional medicine testing. Like clinically, if you're in a conventional medicine doctor's clinic, I don't think they have any way to test for fungal, well, for SIFO. In a research-based environment, they can test doing aspirates of the upper gut. Like obviously that's invasive. And I really don't know of anywhere other than like a university setting that's more of a research base that's actually doing that. So, well, I don't honestly think that many people are even thinking about it anyways, but there's not like a great way to test for it if you're like in a conventional, GI practice or something. So the way that I test for it, and I think that testing is important, is, I do stool testing, but I think, there's a ton of false positives on false negatives on stool testing. Like Candida or yeast overgrowth might not show up. That doesn't mean it's not there. It just means we didn't catch it. And there's a huge issue there with the overgrowth. But I think more importantly, what I see is organic acid testing. So you can do urine organic acid testing, and like Great Plains, for instance, has a microbial oat organic acid test, and it has 9 markers for fungal overgrowth. Some of the other companies do like 3 markers, sometimes just 1. But that can be really helpful. And when I see that fungal overgrowth markers are really high, I think about that. The other way somebody should suspect that is if they have symptoms of SIBO, and maybe they've been diagnosed with SIBO and had a positive breath test, and they've been treated, but they didn't get better. So somebody like that, I would be worried that they have underlying SIFO and SIBO, which definitely is prevalent. I mean, there's one study that looked at a group of patients with IBS type symptoms and found that 20%, I think it was 20 to 25% had overlying SIBO and SIFO. And then I would also think about that in somebody who has symptoms of SIBO. Everybody thinks they have SIBO and then they test for it and it's negative. And you have a negative breath test, and then I'd think, well, maybe it's fungal. So usually right off the bat, I start with an organic acid test on most patients with GI issues.
Awesome. Yeah. So you answered a couple questions just in that alone. So I was curious if SIFO was seen in both IBS-C and IBS-D, and you said it's more the diarrhea prone IBS that you see SIFO in. And then testing. Yes. So organic acids, I've heard, is a really maybe considered even at this point the gold standard for SIFO testing, would you say? I mean, there's not really a test for it.
It's really like an aspirate of the upper gut.
Which is so invasive.
Yeah, it's super invasive. I mean, I don't know that anybody's actually doing that. I know, so Satish Rao is the MD who's done a lot of the research, and that's what he did clinically in his studies. So I don't know that any conventional GI doctors are actually doing that.
Right. Okay. And then,
to do that, just FYI, they might be like, no, I don't know what you're talking about.
Right. And then, of course, stool testing. Yes, I know it's very difficult to detect Candida in a stool test, but even if Candida did show up in the stool test, that could be the large intestine, right?
Yeah, absolutely.
It most likely would be.
If we see it in the stool test, we still don't know. Is it large intestine? We don't know.
We don't know.
The stool test is really testing the distal part of the colon anyways.
Right.
So, there's other markers I look at, so one of the things I look at on a CBC, so if you get just a basic blood count with differential, I look for high neutrophil to lymphocyte ratio, so higher neutrophils and lower lymphocytes. And that can be consistent with yeast. Not always. It's not like if I see that I'm going to diagnose somebody with SIFO off the bat, but it's certainly going to raise my eyebrows and make me look for it. Another thing I do is check for antibodies in the blood to Candida. So you can do Candida IgG, IgM, and IgA. Now it's just checking for antibodies against Candida albicans, and it's just it's just antibodies. I mean, that doesn't even mean that you have a current problem necessarily. So again, I don't pay like a ton of attention to it, but I try to use a bunch of little tools and then sort of bring it all together. And if I see that there's this high neutrophil lymphocyte ratio, somebody has positive candida antibodies and some markers on oat, it sort of all corroborates to support like, and they have the symptoms, right? That it's fungal overgrowth. And then of course there's like this history, like what kind of risk factors, you know, I mean, I spend like 2 hours with patients sometimes listening to their story, and I always try to pick up on like, well, you know, what the main trigger was. If that trigger was antibiotic use or long time proton pump inhibitor, you know, acid blocker use, I'm going to think about SIFO.
Yep, absolutely. Yeah, it is. It's like putting all these pieces together and looking at the big picture for sure. I totally agree. And so let's go back real quickly to the organic acids test, because I do think that's such an incredible test. And so the one by Great Plains that has several different fungal markers, is there one of those markers in particular, or is it kind of you're looking at all of them? And
I'm really looking at all of them. I mean, the arabinitol is the one that I see the most often elevated, and then probably citramalic acid. Like those are the ones that I usually see high, but even if I see the other ones high, I'm still looking. Now, the one thing I do like about the Great Plains test is that I can't remember if there's 3 or 4 markers for furans, and furans can be associated with aspergillus. So sometimes when I see the furans pop up, I think too, like, is there a mold issue going on? Because that can irritate the gut and, you know, be the whole, like, the underlying issue for the underlying issue, you know?
Right. Oh, that's interesting. Okay. Okay, great. So how do you treat SIBO and SIFO differently? And I do have a good bit on my blog specifically about SIBO treatment, so we don't have to spend a ton of time on that one, but I would love to hear about some of your go-to protocols for both, and really how you go about treating SIFO in regards to the diet, the supplements, the medication, that sort of thing.
Okay. So in terms, I'll do diet last, but in terms of like supplements and medication. So I think one of the big pitfalls of treating SIBO with things like Xifaxan or some of the antibiotics is that the SIFO can totally flare. So unless I know that somebody for sure doesn't have SIFO, again, like how do we know for sure? I guess that's sort of a loose thing. But if it's something I'm not suspecting, none of their labs are coming up positive, or really when I look at a 9-point organic acid test, none of their fungal markers are high, that's when I might treat with antibiotics. But in general, I prefer the herbal protocols, like the Candibactin, ARBR, the Biocidin, you know, those kind of things, because those are going to have antifungal properties as well, the herbs that are used, so that they'll work on both. So sometimes if you're treating SIBO, you're actually treating SIFO at the same time when you're using herbs. So herbs are a big go-to. You know, with SIFO in particular, I'm just going to start sort of from the top down. So I always think about, like with digestive issues, I always think about what's upstream. So like upstream, you got to address hypochlorhydria. So what is your stomach acid like? Do you have enough of it? So I like to test for that. And for people who don't have enough stomach acid, I use something called betaine HCl, just sort of depending, you know, on the person. And then I like to,
can I interrupt you real quickly?
Yeah, of course.
How do you go about testing for low stomach acid?
Yeah. So this is another one where it's like, well, you could do the invasive thing, and, you know, a normal gastroenterologist can test for that invasively, but I test with betaine HCl. I just have people use a capsule with the protein containing meal, and if they feel something, they don't need it. And then I'll have them use 2 with the next meal. If they, you know, don't feel anything, then with the next meal use 3, and so on. You know, sometimes people get up to like 6 or 8 and they're like, I didn't feel anything. Am I supposed to feel something? That's when you have hypochlorhydria. So,
gotcha.
You know, these people can take like 6 or 8 of those with a meal, and that, you know, I usually don't recommend like 8 with a meal. It's like, that's enough, but it sucks because it's a ton of pills. But anyways, that's sort of like I use it diagnostically and therapeutically, the betaine.
Awesome.
So like upstream, I'll look at hypochlorhydria, and then I'll look at enzymes. So I do the doctor's data stool test, which gives us an elastase number. You know, that always triggers me then to think about thyroid, because if somebody's hypothyroid, I know their HCl and their acids might not be awesome, and their motility. So it's sort of a umbrella. But I think about enzymes, and I usually use some sort of digestive enzyme, and then sometimes I'll use something called Bilax or ox bile to support fat breakdown. It's also an antimicrobial. And then I also think about motility. So motility, again, goes back to thyroid, but it goes back to the enteric nervous system and the central nervous system. And a lot of this is that gut-brain connection piece. So with, with the enteric nervous system, it's like there can be mechanical issues with motility, like if you've had pelvic inflammatory disease or a lot of gut surgeries or adhesions or endometriosis or something like that, that can create a mechanical issue. But then you can also have this issue with your nervous system. And so, with the motility piece, I sometimes use like motility agents like ginger, or Pure Encapsulations has Moto Pro, or I use a lot of low dose naltrexone, actually, LDN. To help with that. So that's like upstream how I deal with some of the both SIFO and SIBO, just in general sort of digestive issues. And then when you go sort of more downstream, if I see that the fungal markers are really high, depending on breath test and if they have SIFO and SIBO coexisting, I'll use some of the herbal protocols to treat those. And then with SIFO specifically, I like to use ADP oregano sometimes. That's from Biotics. And sometimes I like to use garlic too, like some of the enteric coated garlic, the allicin. And the other one I really like lately is called lauricidin, which is a monolaurin component, and that's known as a biofilm disruptor. So I think then about some of the biofilm disruptors like lauricidin can be, and N-acetylcysteine can also be. So it's another component. And then, I use antifungals. Sometimes I'll use just a nystatin, which stays in the gut and is really, actually pretty benign. I mean, I tell people like everything you take has side effects to it. And a lot of times I end up compounding that medication so it doesn't have a bunch of fillers and junk that you get from a pre-manufactured, dye. Like, why does it have to be So, and I always make sure all those prescriptions are gluten-free and dairy-free and hypoallergenic and all that kind of stuff. But I'll use both systemic and non-systemic antifungals, just sort of depending on the case and how far they've gone. And at that point too, I try to get some sort of sensitivity testing for it. So I do some sort of PCR stool testing and get sensitivity to different antifungals. Because you have to remember too, like there's diflucan, which is fluconazole, but then there's itraconazole, and there's different types of antifungals, and they have different coverage for different fungal infections. And so with a lot of people, I'll end up, using those prudently. I mean, they have side effects, and like when you get into diflucan, like the itraconazole and the fluconazole and things like that, those are pretty harsh medications. I mean, they can really mess with your liver. I mean, I tell people, hopefully they're not drinking alcohol anyways if they're dealing with a lot of GI issues, just because it's not great for the gut. But, got to stay off Tylenol and alcohol. And most of my patients are doing that anyways, so it's not, that much of an issue. But yeah, for sure. I mean, I use those carefully and really prudently.
Okay. Awesome. No, that's so helpful. Because I know a lot of people want to know, do I do natural? Do I do antifungal prescriptions? Like, is there danger in doing that? So it's really great to hear your take on all of that.
The marriage of the two, really, like, and I, conventional training was not easy for me because I was like giving people medications that I wouldn't take myself. But now it's like what I do now, I don't really ever advise people to do things that I wouldn't do myself.
Sure.
So, I mean, I took antifungals and they helped me a lot. I didn't have any side effects from them though, and some people do. So it's just one of those things that I kind of warn people and give them the risk profile, and we kind of go from there.
Yeah, no, that's awesome. And it's like a risk benefit analysis here. It's like, if you've tried everything else and this is,
Exactly. That's a great way to put it. I always tell that to patients, like everything is risk benefit. You have to look at, like, everything has risks. If benefits outweigh risks, then it's something that should be considered.
Yep, absolutely. Totally agree. So in regards to a patient that has SIFO without SIBO, in terms of diet, do they tend to tolerate higher FODMAP foods okay, like prebiotic fibers and things like that?
Yeah, and prebiotic foods too, So, and sometimes it's like the SIBO really isn't the big issue, it's the SIFO. So, yes, I find that people with fungal overgrowth generally tolerate things like probiotics better, and they tolerate prebiotics better as well.
Okay.
So, yeah, usually a lower FODMAP diet doesn't convey a whole lot of benefit for those patients. I mean, and like the other issue is like, how much can you restrict somebody's diet, right? So I try to I'm very mindful of that because I've been there, done that. Like, you can't not eat everything. So the big ones with SIFO and with fungal overgrowth, the big one is sugar and carbs. Essentially you're eating like a lower carb paleo style diet. Really limiting things like, just avoiding, grains and sugar, and corn. I mean, there's some things that have, there's an overlap between mold and fungus. So you avoid some of the things that are known to be moldy, like corn, certain nuts like pistachios and cashews, and peanuts, although they're a legume, can have mold on them. So I usually advise to avoid those. And then, if you're following a paleo style diet, you're probably, you're avoiding dairy for the most part anyways. I mean, some people still do like kefir, goat cheese or something, but definitely you want to avoid things like sausage casing can have mold around it, and aged, aged cheese and aged meat and stuff like that. Sure. But, sugar and carbs is the big one. So I tell people to limit their fruit intake to just like hopefully berries, maybe some pomegranate and grapefruit and green apple, but like generally the lower glycemic fruits, and not a ton of them, like maybe 1 to 2 cups a day. Same thing with starchy vegetables. So, like maybe a cup of sweet potatoes a day, no more, but limit it. It depends how strict you're being. Like, the Institute for Functional Medicine, if you go by their Candida protocol, which I find a little bit restrictive, will take you off of coffee completely, no vinegars. There's a lot to avoid. And I think that it has, like, for somebody to be successful, it has to be doable and sustainable. So I generally, my approach with diet is a little bit more loose, but it depends on the patient. Like if they're an all or nothing person, then I just, if they can do like a really strict protocol, we'll go for it. But from a personal perspective, I can say like, you just try to do your best and like limit your carb intake and focus on high quality fats and high quality proteins and lots of leafy greens and things like that.
No, that's awesome. I agree. I feel like when people are treating something like this and they've been dealing with it for a while, like they want to be aggressive, but it's like, but then they develop, it's easy. And I've experienced this, you develop this fear of food and then your stress goes up and then your gut's all out of whack because of that. And it's just like, you have to have some flexibility. So I totally agree with you. And it sounds like this diet kind of like paleo low carb. I feel like the ketogenic diet is all the rage these days. And it sounds to me like that would be a good protocol.
Yeah, so it's interesting with the ketogenic kind of stuff. There actually has been some literature to show that ketogenic diet makes candida worse.
Really?
And clinically, people see something different than that.
Okay.
So I don't really know for sure.
Yeah,
I mean, I think to be like fully keto, you have to like work at it pretty darn hard.
Yeah.
So I don't know. I mean, I'm not opposed to somebody trying it and seeing if it helps with symptoms. It just kind of depends on where they want to go. The thing about keto that can be hard is like, if you're just doing tons of dairy, like I find that a lot of times when people go keto, then they do a lot of dairy. And, I think usually for candida overgrowth and for SIFO, for most patients, they do better off of dairy.
Yeah, totally agree. Yeah.
But,
sure.
It's like everybody's different and you just kind of have to experiment and see where people feel best.
Yeah, absolutely. So, so once you've treated someone with SIFO, and I'm sure you do this with SIBO too, you have them back in, you retest them with organic acids test and all that good stuff and see where you're at and go from there. Okay.
Yeah, I really like to do like a repeat organic acid test, like maybe 6 months down the road. I mean, these things take a long time to get better. Okay. They don't get better overnight.
Yeah.
It's a long process, but.
Okay. I know with SIBO, there's a lot of times recommended like prevention techniques, prokinetics and prevention diet. Is there anything like that with SIFO?
I think a lot of the same stuff, really. I mean, I think it's kind of, once you have a yeast problem, the problem with the yeast is that they can form spores and you can get more of them and it can come back and you're there's a predilection to it once it becomes your issue.
Yeah.
It doesn't mean you can't I don't know. I don't know if you can completely get rid of it and eradicate it 100%.
Sure.
I think, I don't know. We don't have any studies on it, so it's like, I hesitate to
I know.
But yes, definitely in terms of prevention, I think it's really just like staying away from high carb foods and sugars and staying away from moldy foods. And, I do, like I said, I use a lot of low dose naltrexone and the prokinetics. I mean, I think it depends on like what somebody's problem is and hopefully, if they have a lot of the upstream issues, like if they have less than optimal thyroid, and they have low stomach acid, and they have a problem with low digestive enzymes, it's like people are probably going to use, especially with the thyroid, they might end up just staying on that stuff for a while. But if they feel better and their life is different and they change everything and they have like less leaky gut and are better able to tolerate other foods, I think, from a very personal place, I can say like, I'm okay with that. Like I can stay on low dose naltrexone for as long as it takes, as long as I can eat nuts. Like there was a point I was so sensitive that, I was reacting to nuts, I was reacting to eggs, and it's like, I'll take eggs any day over dairy.
Yeah.
It's like I still basically eat a paleo style diet, but like I use enzymes, I use HCl, I use all that stuff to prevent it from coming back.
I'm right there with you. Yeah, absolutely.
Like if we were out to dinner, we would be good dinner dates.
Yes, I know. We could have fun.
Friends, and you like bring out your digestive enzymes.
I know. I'm always that person that's like
enzymes to share. I'm like, oh, I do.
I know. I'm right there with you.
Would you like some ox bile, or would you like some like pancreatic enzymes, or how much HCl do you need? Like,
right.
But, it's like clinically, that's what helped. And, for me, like if you walk around and you're so loaded, like that you look like you're pregnant and the rest of you is like, doesn't look like you're pregnant, it just doesn't make sense. So yeah, I'm happy to take those things, but I know everybody's different. It's like, and as people start to feel better, you're less motivated to take as many supplements. And I get that, you just have to sort of work with people and meet them where they're at. So you have a plan that's like doable.
Absolutely. Absolutely. Well, this has been so incredibly helpful. Thank you so much for your time and your expert knowledge today. This is like, I've learned so much, so I know everyone listening is going to walk away with a ton of helpful information. So before we let you go, where can people find you? And do you work with people remotely?
I do work with people remotely. I actually have a clinic right now in Metro Detroit, but we're headed back to Colorado, back to home very soon. Oh. So we moved this summer, and I'll be taking patients in Colorado like August 2018. So super excited about that. It'll be another big change, but really nice to be in your family. So anyways, you can find me online at drchristinemaren.com. It's Maren. And, on Instagram, I always post like my favorite gluten-free, dairy-free finds and stuff like that. So I usually post to Facebook and Instagram pretty regularly. And I see patients remotely. So currently in Michigan, I take patients from Colorado and from Texas, but soon that will open up. And I'll be able to see a lot more patients sort of around the country and do remote consultations. But as of now, most of my patients come and see me in person and then do like telephone follow-up.
Okay. Well, that is great. That is great. Well, again, thank you so much. And it was just such a pleasure chatting with you.
My pleasure. You too, Jen. Thanks.
Bye.